Okay, so let's talk about general health and well-being in pregnancy. So I'm going to start with talking about diet. So a healthy diet during pregnancy is important to help support your body and the needs of your growing baby. Prenatal vitamins contain the recommended daily intake of vitamins and minerals during this time, and we recommend that you take your vitamins throughout your pregnancy and afterwards if you decide to breast or chest feed your baby. Your midwife may recommend some extra supplements if your blood work shows that you need them. For example, iron supplements are a pretty common one. Folic acid is another important vitamin to take during your pregnancy as it helps with the development of the baby's spine, heart, and other important parts. If you have a family history of open neural tube defects like spina bifida or cleft palate, or if you're taking medication or have a health condition that inhibits your absorption of folic acid, it's recommended that you take an increased amount, about 1 milligram of folic acid, for the first 3 months of pregnancy. If you do not have factors for folic acid deficiency complications, then zero point 0.4 milligrams is suitable. For more information about healthy eating recommendations, please see the Health Canada Food Guide linked below. A question on everyone's minds when they are pregnant is what foods are safe. The food restrictions that are often placed on pregnant people come from the need to reduce your chances of getting food-borne illnesses. When you are pregnant, your immune system is weakened and it becomes more difficult for you to fight off infections, and some of the bacteria found in food can cross the placenta to your baby. The worry here is that food poisoning can increase the risk of miscarriage, preterm labor, or stillbirth, depending on your gestation. So wash and cook your food, and you should be fine. Check out the Health Canada link below for food recommendations when you are pregnant. One that I don't often see mentioned in the warnings is bagged salad. There have been a few recalls of bagged salad in recent years due to concerns over bacteria. So pay attention to food recalls and eat your leafy greens. Just wash and make the salad yourself. I have included a recipe for smashed cucumber salad below. Cucumbers are high in folic acid, and sesame oil is a great way at keeping your platelet count up. Another important consideration is the use of substances like alcohol, cannabis, and nicotine or cigarettes. As for alcohol, we know that consuming it increases the risk of the baby developing fetal alcohol syndrome. This is more associated with heavy use of alcohol, but we don't know at what level intake is considered safe, so the recommendation is to abstain from drinking alcohol during your pregnancy. If you are worried about your alcohol consumption or any other drug, please talk to your midwife. I have linked some great non-alcoholic cocktail recipes below that are not loaded with high fructose corn syrup or pop, so take a look at those. Cannabis, including THC-leaning or CBD-leaning products, are currently being studied. As it stands right now, we do not have evidence that they are safe to take during pregnancy. THC can cross the placenta, and we don't really know what the long-term or short-term effects on the fetus are. There are some links to low birth weight, as well as behavioral concerns later in life with heavy use. Take a look at the resources linked below in the description. Cigarettes are commonly known not to be a healthy choice in pregnancy, and they are associated with health problems for you, your family if exposed to the smoke, as well as your baby. Stopping smoking before the first prenatal visit may reduce the associated fetal risks to levels of non-smokers during pregnancy. Stopping smoking at any time has benefits to the long-term health of the birthing parent and reduces the risk of the child being exposed to second or third-hand smoke, so that's also great. Quitting can be very difficult. I have linked some resources below. Talk to your midwife and they can help you get set up with supports if you choose to reduce or quit smoking during your pregnancy. If you or your partner smoke, smoke outside the home, change your clothes, and wash your hands before handling your baby to reduce their risk of exposure. All right, a topic near and dear to my heart as I sit here with my coffee is caffeine. So a moderate consumption is considered to be about 200 to 300 milligrams a day, which is about 2 cups of coffee, and this is considered safe in pregnancy. A great place to check out the safety of common exposures like caffeine, as well as other medications, is Mother to Baby. I have linked them below as well. Okay, moving on to weight gain. What's normal? How much can you expect to gain weight? Why are you gaining weight? And how much do you need to be paying attention to this week by week? So, physiologic changes in pregnancy and the growth of the baby account for a large part of gestational weight gain. A pregnant person will gain up to 8 pounds in extra blood volume, 7 pounds in extra breast or chest tissue and fat stores, 2 pounds of uterine muscle, 2 pounds of amniotic fluid, plus the weight of the baby averaging between 6 and 9 pounds. This accounts for approximately 27 pounds of healthy pregnancy weight gain. Maintaining a healthy weight lowers your risk of associated pregnancy complications like impacts on fetal growth, preterm birth, high blood pressure, and gestational diabetes. On average, your daily caloric needs will increase by about 350 calories a day. You're eating for two, but the second one is a baby. They are small. So really that's just an extra grande caramel frappuccino from Starbucks a day. No whip. Eating healthy is important, as we discussed already, but keep in mind everything in moderation, including moderation. You can treat yourself once in a while, but that big old bowl of ice cream after dinner should be a treat, not a daily fourth meal. We're not hobbits, as much as I wish that elevensies and second breakfast were a thing. So for someone with a normal BMI, which is about 18.5 to 25, you can expect to gain about 25 to 35 pounds or 11.5 to 16 kilograms in your pregnancy. For people with a lower BMI, you should gain slightly more, and people with a higher BMI, you should gain slightly less. BMI is admittedly a limited calculation that is based on your weight and height, and individual health needs will impact your health and weight during pregnancy. Weight gain is also not linear. Don't get hung up on gaining a pound a week. Sometimes it will be more, sometimes it will be less. Focus on healthy eating and maintaining daily activity. Maintaining an active lifestyle in pregnancy is very beneficial within your current comfort level. Continuing with your preferred method of exercise is fine as long as it remains comfortable. If you like to run, go for a run. If you lift weights, awesome. Just don't lift a large barbell over your belly. Please keep in mind that hormones released by your placenta loosen and relax your ligaments to accommodate for your growing baby, and you're more likely to pull a muscle than you were before you were pregnant. So be protective with your movements and don't push as hard. For this reason, it's not recommended to introduce new high-impact exercise during pregnancy. Low-impact exercises that may be introduced include swimming, prenatal yoga, and walking. There are lots of great places to access classes like these. I have included some links below to some fitness and yoga classes for you to check out. And my last segment in this health and pregnancy video is dental care. So it's actually really important to see your dentist regularly during pregnancy. Changes in your gastrointestinal system designed to increase your absorption of nutrients during pregnancy also impact your mouth. So please go to your dentist in early pregnancy if you are able to learn more about your dental health. Good dental hygiene and care is one of the best things you can do for your overall health, actually. So I have linked some info below from Health Canada. Take a look. My little PSA in this segment, if you vomit, don't brush your teeth right after. Rinse your mouth with something to increase the pH and lower the acidity, like milk, and then brush. Or rinse with water or mouthwash and then wait 30 minutes and then brush your teeth. So I hope you found this information useful and helpful as we discussed health in pregnancy. Take a look at the links that I have in the description to learn more.